Okay. Hi, everyone. Welcome to our webinar. Today, we will be discussing beating prediabetes strategies for effective lifestyle prevention and reversal. I'm Dr. Chioma Okafomba, and I am a family medicine and obesity medicine specialist. And so today we'll be going through some of the things that one can do to prevent prediabetes. To start off with, I've been a family physician for about 19 years. I've been an obesity medicine expert for 9 years. I'm based in New York and I own Chioma Okafomba Gomez MDP LLC, which is a concierge telemedicine practice that focuses on medical weight loss, metabolic health, and menopause. We see patients remotely, so it's very convenient for everyone. Our patients are based in New York, New Jersey, Pennsylvania, Florida, Maryland, and California. We also see some patients internationally. I'm passionate about prevention, lifestyle, and a holistic approach, and also about effectively incorporating medication or therapies when appropriate. Today, we want to focus on prediabetes. And why prediabetes? Because it's something that's really easy to reverse and prevent. So I want to present a different point of view about prediabetes today. It has a very bad reputation. Whenever patients get a diagnosis for prediabetes, they tend to be very distressed, usually because there's a family history of diabetes or they see it as something really bad. A lot of patients who get diagnosed with prediabetes are generally healthy. They're active, they're young, so it comes as a shock when they get this diagnosis from their doctor saying that you have this condition that could potentially put you at risk for having diabetes in the future and all the complications that come along with having diabetes. So I want to present a different point of view about prediabetes. I want it to be seen more as a wake-up call or a friendly reminder. As a matter of fact, there are not many diseases out there that are kind enough to give us a warning and the time to also reverse the diagnosis. And this is precisely what prediabetes does. It basically acts as a waiting room where you can either decide to stay in that waiting room and wait until it's your turn to enter the door that is diabetes, or you can make the choice to leave that waiting room and go out and do things that we will discuss today, such as lifestyle modifications, in order to not be the next customer for diabetes. Really, I would like to consider prediabetes as a very kind wake-up diagnosis. And so hopefully by the end of this discussion, you will see it as that. And instead of it being such a distressing diagnosis, we'll come to think of it as, something that really does allow us time to make the changes and reverse that likely terrifying diagnosis. So the simple thing about prediabetes is that you don't even need to take medications in order to reverse it. So there are some simple lifestyle things that you could do on your own. Of course, there are people who have a predisposition for diabetes, and prediabetes might mean for them that they could potentially end up with diabetes. However, if that is the case, we can certainly limit it, or we can delay it, or we can prolong the time to diabetes. So let's take it as the opportunity to get out of that waiting room. We do not have to knock on the door that is diabetes. So let's talk about what prediabetes is. Prediabetes is defined as fasting blood sugar levels that are between 100 to 125, or a hemoglobin A1C level between 5.7 and 6.4. So fasting blood sugar level is basically when you go to get your blood drawn at some point in the day, and we tell you to not eat or drink, to not eat for about 8 hours. You get your blood drawn, hopefully in the morning, and then we get a number. Now that number should be anywhere between 60 and less than 100. That would put you at a value or at a risk category that is not diabetic or not prediabetes. If you get a number that's between 100 and 125, this would put you in a category that is prediabetes. This is assuming that you were fasting, not like after eating a donut or two, right? So with that being said, what exactly is diabetes? So diabetes diagnosis would be a fasting blood glucose level of above 126, or a hemoglobin A1C level of above 6.4. 6.5. So 6.5 and above would be a diagnosis of diabetes. So as you can see from these numbers, we do have ample time to make a change before we actually get to diabetes. So we can reverse it and move in the opposite direction rather than towards it. This A1C level that we see here, this is the test that gets done through your blood. It usually tells us what your blood glucose control has been over a period of 3 months. So it's a pretty good estimation. For example, let's say you went to do blood work after Thanksgiving. Your blood sugar might be a little bit higher than you expect, but if we have an A1C that was in that normal range category, then we could estimate that your average blood sugars over a 3-month period is probably okay if your A1C was like a 5.4, even if your blood sugar was 101. So that's the value of having these two numbers, is that the blood sugar is just a time in just one particular number, whereas the A1C will give us an estimation of a 3-month period. So here are some important numbers to consider. Prediabetes can lead to, or can, it basically tells us that you could potentially get diabetes. But what is the risk of getting diabetes if you have been diagnosed with prediabetes? So according to the American Diabetes Association, the risk of progressing from prediabetes to diabetes within 1 year is about 5 to 10%. So if we had 100 people who got diagnosed with prediabetes, 5 to 10 of them could potentially be diagnosed with diabetes within a year. The risk within 5 years is 25%. So 25 of those 100 people could potentially end up with diabetes within 5 years. And the anytime risk would be about 70%. So imagine if we had a diagnosis where out of 100 people, 70 of them would end up having diabetes. But there's ways that we can reverse it that hopefully maybe none of these people would end up with diabetes, or maybe potentially like a very low amount or a limited amount. I think that this is actually a great thing, is that we have the opportunity to make these changes as long as we get this diagnosis early in time. Unfortunately, there are no clear symptoms of prediabetes. So it's not like I could say, well, if you have this and this and this, you have prediabetes and you will get a warning sign to do it. So the best way to check is really by having frequent visits with your doctors. Or if you have a history of overweight or obesity, or a family history of diabetes, or if you've had something like gestational diabetes, which is when your blood sugars are high during pregnancy, then you probably are at risk and you should be checking with your doctor at least once a year to figure out where you stand. Some people might experience some warning signs. So for example, there are some things that could point to insulin resistance. So one such thing is called acanthosis nigricans, which is when you see people with like that really dark discoloration behind their neck. Sometimes it can happen underneath the armpit as well. But that is a really rare case. I mean, we're not going to be looking out for that in order to say we have prediabetes, but it can happen. Some other people might also experience like signs of diabetes. So they might be more thirsty, or they might go to the bathroom a lot, or they might have some unexplained weight loss. However, these are also not something that we can be 100% sure of, because many people who actually have diabetes don't experience these signs or are not aware of it until they're full-blown in diabetes. So it really is not a diagnosis that will give us a lot of warning. And the best way to check would be by checking for a fasting blood glucose, checking for a hemoglobin A1C, or doing a glucose tolerance test. And these are all tests that are done through blood. Who should be tested? We kind of talked about this. So individuals with a family risk factor, so things like obesity, a family history of diabetes, or if you have a sedentary lifestyle, you should probably be concerned and checking for prediabetes. Most of the times when you go to get your annual exam done, your doctor will check either a comprehensive metabolic panel, which has a blood sugar, or an A1C. So if you are planning on getting blood work done, it is a good idea to have this done fasting, because we can then glean some information from that. So we've talked a lot about what prediabetes is, and we've kind of like scared you. But what is the actual risk of having prediabetes? So we know that it is a warning sign, but what are the risks of having prediabetes that does not end up being managed or controlled? Well, for one, you could end up developing type 2 diabetes. Nobody wants this, really. It's not a fun diagnosis. It tends to be lifelong. You may need more medications such as insulin or some other diabetes medications that might require frequent visits to your doctor. So, maybe you may want to start doing those frequent visits now in order to avoid every 3-month visits with the diagnosis of diabetes. With diabetes, there are a lot of other complications. So you could have heart disease, you could have stroke. You're also at risk for kidney disease as well with diabetes. It could also cause nerve damage. It could cause vision problems and blindness. So there are many other conditions that prediabetes and diabetes progression could cause. And so one simple thing or a few simple things that we can do to help prevent you from getting there would save you a lifetime of worry and complication. So we already talked about this. So, what the concern about prediabetes is. So really that preventing the progression to diabetes. It is really easy because we can do lifestyle changes, and these lifestyle changes don't actually have to be very drastic. They could be very simple, and we'll go over what those are, and you could start implementing them as soon as possible. And then it can also improve your overall health. So, I generally say that there's a very good McDonald's combo, which is diabetes, hypertension, and high cholesterol. Those tend to go together. You get one, more than likely you're getting one of the others. So if we can prevent this combo from happening, we are definitely decreasing your risk for heart disease in the future and other types of complications that will go along with having any one of these diagnoses. So what are these lifestyle strategies that I've been talking about? When we say lifestyle, it sounds very glamorous and grand, but they're really simple things. So for example, lifestyle strategies would be something as simple as changing your diet. So adopt a balanced, nutritious diet, increase fiber, reduce processed sugars. I usually recommend making small changes that you can live with. We don't need any grand proclamations. We're not going to completely rid our lives of sugar and carbohydrates and go on a keto diet. That really isn't necessary. What we do need is just small changes that you can build on over time. So for example, if you are able to cut back on sugary or sweet drinks such as sodas or iced teas, so some of those Arizona iced teas, you might think, oh, I'm doing something good for myself, I'm drinking tea. They tend to have a lot of sugar. Some of the trendy caffeinated drinks, so like your Starbucks and whatever else is trending, matcha this, caramel this, those tend to have a lot of sugar. So if you're having like 2 to 3 Starbucks or 2 to 3 caramel macchiatos, or even if you're putting soy milk in it, you're probably increasing your sugar content or your sugar intake. So we can decrease this, or we can go for healthier options. So I'm not saying don't drink caffeine, just make sure that you don't have an excessive amount of sugar or cream and caramel and whatever else we're putting on the caffeinated drinks to make them fun. Juice is another one. So sometimes people think, oh, you know what? I'm going to make this lifestyle change. I'm going to be healthy. I'm going to eat more real foods. I'm going to drink more juice. Depends on what you're doing. Juice contains a lot of sugar. So if we are trying to lead a healthier lifestyle and we're buying one of these like Mighty Mango juices, the sugar content in that could be much more than if you just ate an orange, or much more than if you just went ahead and did the soda. So we want to be careful about what we're doing. Some things that sound like they could be healthy may not necessarily be as healthy. So you want to read the labels and you want to make sure that you're making the appropriate choices. So pick your fruits wisely as well. So some fruits are very high in sugar. So for example, I wouldn't want you to now start having 4 or 5 bananas a day because you think that that's a healthier option. Bananas do tend to have a lot of sugar. Of course, you can have them, but you can have half a banana or 1 banana. So you just want to be very careful and mindful of what you're eating. Search for alternatives for your carbohydrates. So for example, you could switch to brown rice, you could do couscous, you could do quinoa. Instead of your regular potatoes, you could look at taro, or you could look at a purple yam, or you could try like a sweet potato. So there are other alternatives that we can choose without necessarily depriving ourselves of the carbohydrates that might be a staple in our diet. If you truly cannot live without certain types of carbohydrates, so there's some, there are some cultures where carbohydrates are the staple in the diet. So it'd be rice, or if it's like a fufu or pounded yam, something like that, then it's better to work on portion size. So we want to have a smaller portion of that carbohydrate if we're not really able to eliminate it or change it from our diet. Another thing to consider is meal planning. Now, this doesn't mean getting a fancy meal delivery system, or that you have to cook, on Sunday for the rest of the week and eat boring things. Meal planning could be as simple as just knowing what to eat when. So if you are a very busy professional and you can't necessarily get a meal planning service, or it's just not convenient, I would suggest knowing what restaurants or delis or stores are around your workplace, so that you can now look at their menu and you can pick 1 or 2 healthier options. You can check their calories, you can check the stats, and that way you could go, you know what, on Mondays I'm going to eat from this place and I'm going to order this thing. On Tuesdays I have the option of doing this or that. So just having a plan in mind makes it easy, so that when you're hungry, you're not necessarily just reaching as a reflex for the first bad thing that shows up. You can go, okay, no, these are the options. I'm going to pick this, or I can do this. So meal planning can be as simple as that. It doesn't have to be very time consuming or tasking. The other thing would be just being very mindful about what you're eating. So this just means that you should try to avoid nighttime snackings, or choose better snacks, avoid eating in front of the television. There's a lot of mindless eating that goes with that. You're just kind of like reaching into a bag and putting it into your mouth. You're not really paying attention. So be very mindful when you're eating. Be engaged in your meal. Stop when you feel full. Put it away. Make it difficult for you to access. So these are just very simple things that you could do. Next thing in terms of lifestyle would be physical activity. So, even if you're a very active person and you're going to the gym, you could still have this diagnosis. So maybe physical activity is not necessarily an issue for you. However, for a lot of people, they may not be as active, or, the thing I usually hear is, well, I walk a lot at work. So physical activity should really be what you're doing for exercise outside of what you would usually do in your job. So if, for example, you work for the MTA, or you are a nurse and you're going up and down stairs, you're very active, you're going, you're walking 10 blocks to work. These are things that you have to do every day, no matter what. So your body, your calorie count, everything is already acclimated and adjusted to that. We want to engage in additional physical activity that you're doing for exercise sake. And so we could add 30 minutes a week, 30 minutes every day, just to increase the exercise for a minimum of about 150 minutes a week. This should be anywhere from like a moderate intensity exercise. So you should feel like you're a little bit out of breath. So when you're exercising, so for example, you shouldn't be able to comfortably have a discussion or sing. You should, have to pause if you're exercising. So this would be my recommendation. And there are simple ways to get started with this. So you can start by walking. If you're not already very active, you can increase your step count. You can take the stairs whenever it's possible. You can get off a few blocks before your stop, even if it's not really necessary. You can park your car further away so that you now have to walk, whatever across the parking lot to the store. Or you could park your car like several blocks away from your home, so now you have like that extra walking that you've added. Strength training is also very important, so things like planks and squats and sit-ups, those things will help build your muscle and will also help with utilizing your glucose properly. You could also join a challenge at work. Many jobs or many employers offer different types of challenges. You can invite your friends, you can use a Fitbit or Apple Watch. You can invite your family members as well to join and keep you company. So that way you don't feel like you're alone and you're doing it in conjunction with other people who will hopefully be there to support you and push you forward, encourage you to make these changes. Who knows, you might be making a difference in that person's life by involving them. So besides these like basic things that you can do, there are some things that are really more lifestyle related. So nobody likes this, but limiting alcohol. Alcohol is purely sugar. So if we can limit the amount of alcohol that you're ingesting, you are in effect limiting the amount of sugar that you're getting into your system. Now, alcohol is not completely bad. So if you're having like one glass of wine here and there, once a week, twice a week, it's not the end of the world. But I would definitely stay away from like your mixed drinks. If you can limit the amount of beer that you're drinking, those are things that could really be helpful. And those are things that are easy to do. Another thing would be choosing wisely when you eat out. So for example, we talked about like checking menus around your job, but we might also want you to do this before going out to dinner with friends. So maybe you're checking out the restaurant's menu. You're going to avoid bread at the table. You really don't need that. Or if you do, maybe have a small portion and make sure they're not refilling the bread. You may want to share a main course with somebody. You may want to limit the appetizers to like 1 or 2, maybe 3, depending on how many people are there. You don't have to eat dessert at the restaurant. You could always choose to have a healthier dessert option, maybe fruit or maybe a low calorie ice cream or something else at a different location. So you don't have to have it at the restaurant. The portions tend to be really, really big. If, however, you happen to be having your dessert at the restaurant, it would be a good idea to share it with others. Have a few spoonfuls rather than having a full dessert to yourself. Realizing that there's no perfect diet. So this is very important because sometimes patients ask, well, what's the diet I should follow? I need a diet. Just choose one that you can stick with. That's the most important thing. It doesn't help you to start a diet that you're not going to stick with or you're not going to follow. Just pick one that works for you and your lifestyle, or just make small changes rather than sticking to a diet. So it's easy for you to say, I'm going to drink more water. I'm going to eat less rice. I'm going to have more fruits and vegetables, and actually actioning those things rather than going to search for like a carnivore diet or like a keto diet. Just pick something that works for you and go with it. Make sure that it will mesh well with your lifestyle. Stress reduction is really important. So people underestimate how much stress has a part to do with your hormonal balance and your glucose levels and your sugar. So learning how to reduce your stress is very important. Taking time for yourself, resting, going out, walking in the park, going to sleep early. Sleep is very important for decreasing your cortisol and stress levels, making sure you're getting at least a good 6 to 8 hours of sleep. Sleep is also very important for weight loss, which, by the way, is the #1 thing that we would recommend for improving your risk for high blood pressure, decreasing your risk for high blood pressure, prediabetes, diabetes. Weight loss is usually the first thing your doctor will recommend. Choose outdoor activities. So, if you're meeting up with friends and family, you don't have to meet up at a restaurant. You don't have to eat. You could actually choose to do an outdoor activity. You would still spend time with this person. It could be something fun or different. So you could go walk in the park. You could go take a class. You could learn how to do something or make something. You could go to a museum and walk, even if you're not interested in anything that's happening in the museum, but you have space to walk, especially if it's a cold place. That could be something that you do, is just an indoor walking. You could go to the mall, as long as you don't go to the food level. You're probably fine in the mall as well. So these are like different things that you could include in your life that could make a big difference. And even by just doing a few of these things, you would probably be able to improve your glucose numbers and decrease your risk for diabetes in a period of like 6 months, maybe even sooner, depending on how committed you are. As I mentioned, weight loss is really the number one thing that people will advocate for prediabetes, management and prevention. So if you are overweight or obese, even if you are not, losing about 5 to 10 pounds can help decrease your risk for prediabetes and the progression to diabetes. So just that alone would probably make a big difference. It may not be the only thing that you have to do, but that could certainly make a difference. So the thing that obviously many people want to know is, well, are there medications that we can take for prediabetes? Well, there certainly are medications. However, taking medications, we always want to leave as sort of like, I don't want to say a last resort, because there are people who will need medication. And of course, I prescribe medication, so I don't want to advocate against it. However, we want to make sure that even if you are taking medications, that you're including these lifestyle changes, because that's the best way to maintain it. So in terms of medications, we have an oldie but a goodie, which is metformin. And so metformin has been around for so many years. It works well. It does a great job of improving your glucose control and your insulin levels. So it's a very simple thing that we can take. It's a once-a-day tablet. At our clinic, we are very skilled at initiating it so that you don't experience side effects. So that is a very simple thing that you can start. We also prescribe GLP-1 injections, such as semaglutide, which are your Ozempic and Wegovy, and tirzepatide, which are your Mounjaro and Zepbound. There are other GLP-1s, such as liraglutide, that are available on the market, and many more to come. For those people who are actively seeking weight loss, this is obviously a good way to get both of those things going at the same time. However, we do understand that not everybody wants to start a medication, and not everybody will necessarily need a medication. So that's why we like to focus on that lifestyle change as a starting point. The other important thing is just having regular follow-up. So if you're not seeing your doctor regularly, you would not be able to diagnose prediabetes, and you may not get that opportunity that we talked about to now intervene and change the course of action. So we want to change the course of your life. We want to take it in a different direction. We want to take it away from diabetes. Of course, everybody needs a different approach, a different strategy. So at our clinic, we do offer very personalized interventions. We will work with each and every patient to make sure that whatever we are doing is in line with their lifestyle and with their goals, as well as their family history and their risk. So there is no one size fits all. Everything needs to really be individualized to each person. So that brings us to the end of our very quick talk. Hopefully this was helpful. I will now open it up for questions. And let's hope to see you guys at our clinic soon.